It's my pleasure to hand things off to Leslie Milano, CEO of APIC Consulting. She'll be providing a brief introduction and will be introducing today's panelists.
Thanks so much, Evelyn. Good afternoon, everyone. My name is Leslie Milano. I am the CEO of APIC Consulting. We are truly pleased to welcome such a strong turnout today. It underscores the importance of the conversation that we will be having. Between APIC and APIC Consulting, we have had the opportunity to partner with almost every single state health department in the US, as well as many of the nation's largest local health departments too. While some of this work was temporarily paused earlier this year, we are pleased to share that projects have slowly resumed, and we remain committed to supporting health departments with assessments, training, and resources wherever needed. I also want to acknowledge the many familiar names we see joining us, particularly HI coordinators and others that we've worked closely with in the past or are working to support right now. It's wonderful to have you with us today. Before we begin the presentation, actually, I'm going to bypass that piece. We're going to start with just a couple little slides here about APIC. So Evelyn, if you could put those up. As many of you know, APIC, the Association for Professionals in Infection Control and Epidemiology, has been the leading professional association for infection preventionists for more than 50 years. Today, APIC is proud to represent more than 15,000 members. APIC is a thought leader in IPC, partnering with government agencies, nonprofits, accrediting bodies, and others, all with the shared goal of reducing healthcare-associated infections and improving patient outcomes. Next slide. Some of you may know about our subsidiaries. APIC has 3 subsidiaries. We have APIC Consulting, the consulting arm, which contracts directly with state health departments, QIOs, every type of healthcare facility on assessments, training, and a large number of additional scopes of work. We have CIPAC, the Certification Board of Infection Control, and we have AGIC, the peer-reviewed journal. Next slide. And this is the last one that I'll be chatting with you today about. APIC Consulting has the largest network of IPs throughout the US with more than 350 CIC certified IPs with an average of 20 years experience. We have been so proud to support via grants and contracts our state and local health departments across the US, whether it's additional capacity that's needed or specific expertise on a given area in the field. So for more information, I invite you to visit our website. We have a new website, actually, apicconsulting.com. And on behalf of APIC and APIC Consulting, we are delighted to bring you this important webinar as your partner in infection prevention and control. I am pleased to introduce to you today the panelists. We have Lisa Tomlinson, who leads the government affairs team at APIC. She focuses on APIC's overall government affairs strategy. She is joined by Nancy Halpern and Monica Alexander. Nancy leads APIC's outreach and response activities with federal agencies, and Monica leads APIC's legislative advocacy and outreach to congressional offices. We look forward to hearing their presentation today, the 2025 Federal Legislative and Regulatory Landscape for Infection Prevention and Control. Lisa?
Great. Thank you so much, Leslie. And we really appreciate APIC Consulting, one, the cross-pollination that we get with you all, but also your invitation to be here today. So thank you so much. Next slide. So none of us have any relevant financial disclosures. We thought we would share that. And the next. What we hope to do today is to share with you the big picture. So overall, how everything fits together for us in the current legislative environment, go through a legislative update, a regulatory update, some of APIC's strategic policy priorities and how they're impacted in the current environment, and then show you where you can find APIC's public statements. Next slide. So first, the big picture, and that's the part that I'm going to bring to you today. Next. So all of you, whether it's in a state health department or in a state facility, are focused on breaking the chain of infection. First of all, we want to say thank you for what you do. That's so important in our community, and sometimes it's one that people don't always know the important work you're doing. So we want to thank you for that. Next slide. What we've been focused on over, we have probably around 43 years of experience between the three of us, between Nancy, Monica, and myself, on focusing on the federal role in infection prevention. So, over the past couple of decades, there's been significant support from the federal government. Sometimes we had to provide advocacy to get there, but we're now moving in an unprecedented direction related to the federal role in infection prevention. So we've got right now a lack of evidence-based guidelines that can be trusted, lack of infection prevention and control cooperation at the state and facility level. That's so important. A lack of clarity around proper cleaning, disinfection, and sterilization. We have less cooperation on infection prevention and control at the international level. We're less focused on peer support or on supporting implementation, science, and infection prevention and control education through agencies like ARC and CDC. And then we're really beginning, this was very surprising to me, but focusing on limiting support for research, both at NIH and NIAID. Next slide. So for each of these areas, I'll go over a little bit, and many of you know these things. I'm just going to touch on them briefly, but I put information on the slide so that you'll have it if you need it. But there's been an elimination of both HICPAC and replacement of ACIP. Nancy will talk a bit about that later in her presentation, but with HICPAC guidelines being widely accepted as a standard of care by healthcare accrediting organizations and by CMS, and really daily use of those recommendations from our members to keep people safe from HAIs. And then with ACIP out there as the standard, both at the state and federal level, and by insurers and others, to ensure that vaccine recommendations are based on the best scientific evidence and not politics. We're seeing that change. At the beginning, APIC did initiate a joint letter between several different organizations in the EPI and ID space, telling Secretary Kennedy how important it was, how important HICPAC was to us. We're continuing some of that focus with ACIP. We'll talk a bit more about that on next slide. So on state and local infection prevention and control support, as those of you on the call know how important that funding is, when we heard about the clawback for federal CDC grants, we related especially to ELC and to COVID relief funds. We actually launched a full court press to inform both legislators and those in the press who feeds into that group of individuals, that the importance of these programs. We gathered information. Some of you on the phone may have shared information with us. We appreciate that. But at the bottom, I've highlighted the president's budget, but Monica will talk a bit during her presentation about where we are on funding for those things. Next slide. Cleaning, disinfection, and sterilization expertise. The agencies, of course, FDA and EPA are the ones, but specifically FDA with the cleaning, disinfection, and sterilization. With the focus on that, APIC has been engaged in work on our instructions for use project, reaching out to FDA. They've been open to having conversations with us, but as you can imagine, with thousands of positions eliminated, some of those restored through the original DOGE cut. Some got there, didn't have desks, all of that. And now a decrease recommended in the president's budget. There's a lot of difficulty and chaos there, focusing on anything but really the things that are top of the president's agenda. Next slide. International knowledge and cooperation. As you all know, one of the president's first items when he got into office is withdrawing from the World Health Organization. We put out immediately a statement focusing on the importance of the World Health Organization's role. We continue to support international cooperation, and if we can't do it through the international bodies, APIC will support these efforts by participating in international meetings and the like. Next slide. Implementation Science and Education, ARC is a unique agency in terms of what it has provided over time related to HEIs. This agency is in real danger, and Monica will talk a bit more about specifics on that. We did do outreach to the media, as you can see here. Our president was quoted in one of the main sources of news to legislators, and we continue to make the case for ARC. Next slide. Finally, NIH, and that has been an agency, excuse me, that's been supported by people on both sides of the aisle for quite some time. And we were really shocked to see the dramatic cuts to NIH. Apologies, it's allergy season for me. And so what we're seeing here in the president's budget request is a sign of, I think, the direction we're going on this, and that is unfortunate. Next slide. So we're going to have a polling question, I believe, next. And then after that, Monica is going to give you her legislative update.
If you're ready, you can move to the next slide. Okay, everyone, I wanted to sort of start at the beginning, and so I'm going to do my best to make good time here. So, balance of power. The balance of power is shorthand for what political party controls Congress and the White House. We are now in the 119th Congress, and as you can see, there are 219 Republicans, 213 Democrats, and 3 vacancies. The vacancies are due to unexpected deaths of Representative Sylvester Turner of Texas, Representative Raul Grijalva of Arizona, and Representative Jerry Connolly of Virginia. Now, a little over a week ago, Democrats picked up 1 seat due to the special election of Representative-elect James Walkinshaw on September 9th, so literally just a week ago. He was a former chief of staff for Jerry Connolly. Now, in the Senate, there are 53 Republicans, 47 Democrats, with two independents who caucus with the Dems. So we're 45 plus the 2 gives us, oh, sorry, I just had a poll just show up out of nowhere. So let me just start over for a second. In the Senate, there are 53 Republicans, 47 Democrats, which includes 2 Democrats who caucus with the Dems. There has been no change in the balance of power on the Senate side since the November 2024 elections. To remind you, the Republican Party has a triple crown this cycle. That's when one political party controls both the House, Senate, and the White House. Politicos like me and Nancy and Lisa refer to this either as a trifecta or triple crown. In this political cycle, that's what we have. However, changes are expected in the November 2026 elections because historically triple crowns usually only last 1 election cycle. So we'll have to see if that holds true. So let's focus a little bit on the House for 1 minute. Most bills in the House are passed by what's called a simple majority. And as much as I do not love math, let me define for you what a supermajority is, because it's important for you to understand why these voting margins are so razor thin. So there are 435 members of Congress, but with 3 vacancies, we only count based on active voting members, which brings us to the number of 432. The formula for a supermajority is then 432 active voting members divided by 2 plus 1, which gives us 217. That makes 217 the magic number that determines whether a bill fails on the floor or not. Since the Republicans stand at 219 votes, they can only afford to lose 2 votes total before a bill fails. This is why numbers matter. Since there is no tie breaking in the House rules, what you will see is strategic gamesmanship, like holding votes open on the floor until leadership can flip those votes in their favor, as was done with the One Big Beautiful Bill Act. Now, however, in the Senate, Republicans can only afford to lose 3 votes, which puts them at an even 50 votes, which then could trigger a tie because we've got 100 members in the Senate. This is when the vice president steps into the Senate as president of the Senate to break that tie. If they lose 4 votes, then there is no tie to break and they lose that vote to the Democrats. Bottom line is a win, no matter how small the margin. Next slide, please. I'm going to assume that given all of the wide reporting, you've all heard of the president's big, beautiful bill, or ABBA. Now enacted, it has 6 very complex policy pieces to it, which is why it's been nicknamed the way it has. So big, it's beautiful. Well, we'll just go with that. What's in it? Tax policy, border security and immigration, defense, energy, and the debt limit, and of course, Medicare SNAP benefits as well. This $4 trillion package makes tax cuts from 2017 permanent, adds money for border security, immigration, and defense. This gets paid for by gutting funding for federal programs, or in many cases, by eliminating federal programs altogether, thereby dismantling federal agencies and sub-agencies to free up that $4 trillion they needed to cover the cost. As you think about this, please consider the HHS cuts and the elimination of HAI grant programs, as well as HICPAC and ACIP. Now, regarding Medicaid, I wanted to give this an honorable mention because in the scheme of things, this will have a great impact on our nation's public health. But also, these kinds of cuts to Medicaid are expected to leave at least 11.8 million people without health care over the next 10 years, according to the Congressional Budget Office. And that sets up some foreshadowing for increased ER visits and hospitalizations by this future uninsured population. I can only imagine that your facilities have already begun to plan for that likely scenario. So, the Senate passed an amended version of the bill on July 1st, 2025 by a 51-50 margin, with Vice President Vance casting the tie-breaking vote. And this law was signed in on July 4th, 2025. So we now have enacted law of the One Big Beautiful Bill Act. Next slide, please. As you can see, we have top-line marks for CDC's emerging and zoonotic infectious diseases under CDC, but no final numbers considering the appropriations work has not been completed yet. So that's $812 million of final continuing resolution, or CR mark, for FY25, which was signed into law March 15th, 2025. $870 million from the president's budget request for FY26, $822 million, which includes $45 million in transfers from the Public Health Fellowship Fund, or PPFH, from the House Appropriations bill for FY26, and then $763 million from the Senate Appropriations also for FY26. So just really quick, so we got $24 million across the board for NHSN. Same scenario with $40 million across the board for ELC. However, the HAI program is facing a significant difference in proposed funding for FY26. The president's FY26 budget request proposes eliminating the program, while the Senate while the Senate's bill allocates 12 million. The House bill provides no funding, so we're going to have to see how that shakes out. We have some slight deviation with both committees here appropriating lower at 40 million than the president's requests. Appropriating lower at 40 million. With the president's request at 66 million for AMD. We have 197 million across the board again for antibiotic resistance solutions initiative. And then I want to talk a little bit about ARC. ARC has been technically eliminated during HHS restructuring, with some activities expected to be absorbed in the Office of Strategy at Make America Healthy Again, MAHA, which is appropriated some funding this appropriation cycle in the House. We'll have to sort of see and continue to track where those activities are, how they are going to be managed and how they're going to be funded. So that's like a big old question mark for us. So I want to also quickly circle back to what I said a bit earlier about how we do not have final marks on these appropriations bills. It's important to note that because it puts us in time for the next showdown over another government shutdown in about 2 weeks on October 1st. Looks like House Rs have made some gains on passing a 7-week short-term CR that expires on November 21st. As of last night, they were able to pass a procedural vote on party lines that would allow consideration of a CR as quickly as tomorrow. If they hold their conference in line, they won't need any help from the Democrats to pass it. And that makes the Senate a whole other matter. Dems in the Senate are dug in on reversing Medicaid cuts as one major demand, and they're not seeming to budge until Republicans agree to negotiate. So these are things that we are very, very quickly, or very closely, I should say, monitoring as things sort of change minute to minute. Next slide, please. Given where all things stand, it has become more important than ever to establish and strengthen our relationships on the Hill. To date, I've met with over 40 offices educating members and staff about the issues most critical to our membership and stakeholders. And as you can see in all of these places that are marked on our nation's map, we're making headway. And I'm buying more shoes to walk through the halls of Congress. Next slide, please. While we know that education is key, and I'm meeting with congressional offices, members want to hear from you. And if you've not sent your letter to Capitol Hill, please take a minute now to scan our QR code to send your letter to Congress asking them to support these programs that are so critical to your work. Alternatively, you can also just go to apic.org, undertake action on the public policy page, and click on the appropriations letter. We need your help, and it only takes 3 minutes of your time. Thank you. And to you, Nancy.
We're going to have a quick polling question before Nancy starts, and then Nancy will go ahead and go.
Okay, hi everybody. First of all, forgive my voice. I woke up this morning and my voice decided not to. Um, so I'll do my best. Next slide, please. As Lisa mentioned, the administration started off the year by an executive order basically eliminating advisory committees. So among the ones that APIC had been working with were the President's Council of Advisors on Science and Technology, or PCAST. That was immediately disbanded, but then immediately reconstituted to focus entirely on technology and not on science. And then there was PACCARB, the President's Advisory Committee on Combating Antibiotic-Resistant Bacteria. And that was disbanded completely. HICPAC, as Lisa mentioned, also has been disbanded. And ACIP, you've probably been following this, that the Secretary decided to retire the existing members and has reconstituted it with those aligned with the Make America Healthy Again agenda. The reconstituted ACIP is having its meeting today and tomorrow. So we'll have more information about what goes on there. Next slide, please. We haven't seen a lot in the way of new regulations this year. As a matter of fact, those of you who attended our presentation at annual conference will find that this is not a whole lot different than that one was, because there hasn't been a lot to update. We were a little worried at the beginning of the year when Secretary Kennedy announced that he didn't feel bound to follow the notice and comment practice of rulemaking. But the only rules that have come forth so far have been those to Medicare prospective payment systems. So, and the Medicare payment systems are required under the Medicare Act to be updated and have to go through this notice and comment practice every year. So what has come up so far every year are payment system rules relating to hospitals, LTACs, SNFs, inpatient rehab, inpatient psych, hospital outpatient, ASC, and end-stage renal disease. And we've already gotten back the rules, the final rules on the first ones. Hospital outpatient and end-stage renal disease, we have not gotten the final rules back. Next slide, please. So they've all had a number of common elements, and I'm going to try and go through this really fast because I don't want to cut into the Q&A time. But the NHSN HAI measures, this was a technical update that is required every time NHSN does, and we have a typo there, I'm sorry, does a rebaseline to make sure that CMS payment determinations match the SIR levels for the appropriate rebaseline. There also was an update to the extraordinary circumstances exception policy, which kind of reversed a movement that happened a few years ago. So it reduces the request deadline for a facility from 90 days to 30 days to request an exception, and makes clear that CMS will decide whether what your facility gets is an exemption from reporting requirements or an extension of those requirements. Next slide, please. The other thing that has been across the board is the removal of the healthcare personnel COVID-19 vaccination measure. These numbers are no longer of value because they're not required, and so the data is not accurate anymore. So APIC supports their removal, but we made clear in our comments that we continue to be a strong supporter of healthcare personnel vaccination against COVID and all other vaccine preventable conditions. That we're seeing, or another thing that we're seeing across the board, are efforts to remove everything relating to health equity. So a measure was added a few years ago as a hospital or facility commitment to health equity, which is an incentive drive to enhance improvements and eliminate disparities, and also measures on reporting of screening for social determinants of health have also been eliminated. Next slide, please. In the OPPS rule, the Hospital Outpatient Prospective Payment System proposed rule, there was one other provision that didn't come up anywhere else because it doesn't need to, but that was a proposed change in methodology for the overall hospital quality star rating program. So notice this was in the hospital outpatient rule, but it's the hospital quality star rating program. The issue that was trying to be addressed is that under the current methodology, it's possible for a hospital to receive a 5-star rating, even if they score low in the safety of care measure group. As long as the scores in the other measure groups are high enough. So that doesn't seem right. And so the proposed solution is in 2 steps, one that would take place immediately and the other that would take place going forward. So the immediate solution would be to implement a 4-star cap on hospitals in the lowest performing quartile in the safety of care measure group. There are actually 5 measure groups, and safety of care is one of them, but they're not all measured equally. And hospitals don't have to use all of them. They don't have to report all of them. They can choose which ones, but one of them has to be safety of care. The next step would be to implement a blanket 1-star reduction in for hospitals in the lowest performing quartile in the standard of care measure group. And that's for star ratings in 2027 and thereafter. So going forward after that. So our concern was that this lopping off a star doesn't actually address the methodology that resulted in the problem to begin with. Talking about taking off a star for the lowest performing quartile kind of smacks of the HAC reduction program, where hospitals are compared to other hospitals, but it doesn't really do anything to solve the methodology that's a problem. So in our comments on this, we wrote that we support, we fully support and encourage an additional focus on the safety of care measure group, but that the proposed solution doesn't get at the real problem. For APIC, part of that real problem has always been the use of composite scores in determining domain scores. And HAIs have always been lumped in with other conditions. So there's never been a composite score simply for HAIs, but across the board, the composite scores have always been a problem. So that's what we wrote in our comments that we submitted last week. Next slide, please. This is just a screenshot of how you can find information on APIC's regulatory comments. If you go to the APIC page if you go to the APIC website, under the public policy tab, if you click on regulatory comments, you will see a list of all of the comments that we have submitted. They're in chronological order. We always put the newest one at the top. At the bottom is a link to that page to make it easier for you. Next slide, please. And I'm going to send it back to Lisa.
Yeah, and real quick on this, next slide, I'm going to talk about the APIC strategic priorities, but how we've reframed them or are focusing on them given the current environment that we find ourselves in. So as you can see, we're focused on retaining NHSN. We were concerned about there might be efforts to dismantle that or come up with different reporting methodologies. And so we're focusing on that in our funding. So far, so good on that. HAI surveillance and IPC staffing in long-term care facilities. We do have goals there. We would like there to be one dedicated IP instead of designated. We'd like that person to be dedicated to IPC, but we understand that retaining the current regulations and avoiding rollbacks and requirements in long-term care is probably where the focus should be currently. And then building the infection prevention and control workforce. The current administration has closed previous programs that would deal with apprenticeships that were particularly apprenticeship focused related to healthcare. So we're looking for other avenues to forward that agenda. And then our reforming and modernizing medical device IFUs, we are still heavily focusing on that. We are staying in touch with the FDA, inviting them to our meetings. We're trying also to expand our partners, and we're working right now with accrediting bodies around how we can we can be consistent in terms of the way people are surveyed around IFUs, and particularly when it comes to using a high quality risk assessment. Next slide. So public statements also, we just wanted to show you where you can find those. So next slide. When APIC puts forward comments on big picture items at the federal level, here's where you can find them, apic.org/news. So you can feel free to cut that into your browser. One thing that's not quite in our news statement yet, because ACIP is still meeting, and so I just want to add this, is that APIC did sign on to a letter related to the ACIP meeting that's going on today and tomorrow, and we're asking, along with about 49 others, about 50 people on the letter, is asking them the CDC and the committee to abide by the ACIP charter and their workforce guidance, in particular their evidence to recommendations framework and their grading of recommendations, assessment development, and evaluation or grade methodology. We are trying to get them back to focusing on the evidence there. And then we also are noting a couple of things that we think that ACIP should focus on. One, making sure that they recommend the COVID vaccine, which clearly they have not been moving in that direction, but urging the committee to clear up confusion and recommend the COVID vaccine for all Americans aged 6 months and up. And then also to act decisively to approve the full schedule of vaccines without limiting choice and creating barriers to access. The letter is much longer than that. We will be able to post it when our coalition allows us to post that, probably later tomorrow. And so we'll put that up on the page as well. So we just wanted to know where you can find things. Next slide. So we're going to questions now. And let me go to the Q&A here and see what we've got in the way of questions. And also, I know we have some here. One is whether people will have access to the slides. So I assume yes is the answer to that. Are slides going to be forthcoming? Evelyn?
Yes, we can share the
Okay.
slides, and
Okay,
the
great.
session is being recorded as well, so that'll be shared also.
Wonderful. Okay. And so, so one of the things, I think that this is for Nancy, and this I don't know if this would be for you, Nancy, or from someone on our practice guidance side, but it's relating to advocating for HOB versus specific definitions. It says hospitals have had to focus on so many resources to surveillance and initiatives that focus on reducing HAIs that meet definitions versus focusing on workflows and practices. She's saying that work is not contributing to APIC's mission and not getting to the root cause of the HAI issue within healthcare facilities. So she says she supports the HOB metric as it's shifting to solving true HAI issues. Do you have something to add on that, or what discussion there might be on that, Nancy?
No, the only thing that I have to add is that metric has not been finalized yet. With the elimination of HICPAC, I'm not sure what the status of it is now, but it's still in the discussion phase. It hasn't been added to anything yet. So we have nothing moving forward on that.
Great, thanks. So there's also a question stating that I had mentioned that NHSN was fairly safe from funding cuts. And I think what I said is so far so good on that. And what I mean by that is that that's one of those that on Monica's slide, I believe it was at 24 million across the board. So that basically means that's what it got in the previous fiscal year. That's what the president's recommending, what the Senate's recommending, and what the House is recommending. I think that was an across the board is why I was saying that. That's typically a good sign. We, of course, never act like there's victor. We keep stating, and Monica keeps asking for that in every meeting she's in, so they know that we want that. But we think so far so good. Now, I will say this, on some of these programs, it's a little bit sort of confusing, because when Monica mentioned the Prevention and Public Health Fund, specifically around one of the funding areas, that Prevention and Public Health Fund is something that is under attack, and funding from that has been utilized to backfill other programs. So it just gets to sort of what level funding looks like. It doesn't get to any increases or improvements to NHSN, which we would like to see. We think in the current political environment, that's not likely, but we're pleased, given that going into this, we were concerned there might be a complete reboot of how we collect data, and that was concerning. So I hope that answers the question. And then there's a question, I think this is a really good one, and sort of gets to what some of the vaccine questions. And so I'll do my best to answer this, Nancy, and then if you have anything else to add on the ACIP piece. So somebody asked, are we going to be reaching out to California, Oregon, Washington, and Hawaii, who formed a health alliance? I don't know. I did speak to our CEO about this. I don't know if he's reached out to them yet. I do know this, that in Washington, there is a coalition of groups, the Immunization Action Alliance, the American Academy of Pediatrics, the American Medical Association, SHE, I know, APIC, and others are coming together around vaccines and whether or not we need to form vaccine recommendations. And so I know that regionally people are doing this as well. We have reached out to that group and participate weekly in calls with them on what is next, and have offered our support as needed to that group. So I do think it would be a good idea to reach out to these groups. I also see as good news the fact that we're beginning to hear from insurers. Insurers are saying, look, we plan to continue to pay for these vaccines, because obviously from an insurer's perspective, it's much less expensive to cover a vaccine than it is a hospitalization. So yeah, good idea. I don't know if Devin's reached out to them, but if not, we can certainly do that. It makes good sense.
Thank you, Lisa. Unfortunately, we're at time, so we don't have any more time for more questions. However, if you do have any additional questions or would like to discuss ways that APIC and APIC Consulting can help support you and your organization either this year or the next, please feel free to reach out to us at info@apicconsulting.com. Again, a recording of today's webinar will be shared with all attendees via email within the next few days. So you'll have the opportunity to revisit the discussion or share it with any colleagues. But with that being said, on behalf of APIC and APIC Consulting, we thank you again for being here with us today. We look forward to staying connected and sharing more insights with you in the future. Thank you all.